Hi, Paul Griffin, Director of Infectious Diseases. So since this incident began, we've been working very closely, largely communicating on at least a daily basis with Queensland Health and the public health teams that are responsible for managing this. So we're certainly doing this very collaboratively with the broader public health network to try and make sure we stay on top of it. The situation with COVID-19 in the community continues to evolve rapidly. We have diagnosed one patient with COVID-19 at the Mater South Brisbane, but given the measures instituted rapidly in terms of identifying and quarantining staff and patient contacts, we are confident there is no greater risk of acquiring COVID-19 at any Mater facility than there would be in the general population at present. Upon diagnosing our only case of COVID-19 at Mater Hospital Brisbane, we've identified there are 15 staff who were contacts with this patient, and they've all been contacted and placed into quarantine. These staff members have been placed into quarantine as a highly precautionary measure. While the actual risk is very low, we felt it would be safer to keep these people isolated until we're absolutely sure that they also are not positive. So we went to great lengths to identify any potential contacts of the index patient at Mater Hospital Brisbane, and we are confident that no other staff are potentially at risk of this infection. We've mounted a very robust response to ensure that our patients and our staff have been safe and will remain safe throughout this situation. As the situation with COVID-19 continues to evolve, the messaging really remains the same. What we're asking people to do is to keep doing the things that we ask every year during our flu season, for example, which is to pay careful attention to hand hygiene, to not come to work if unwell, and to adhere to our messaging, particularly around the right PPE. We are confident that if people can adhere to these very simple messages, that they will remain safe and help us protect other staff members and all of our patients at all times. I understand lots of staff have questions about this situation at the moment as it continues to evolve very rapidly. We have set up an intranet page that has all the required information available in one place, and I'd encourage staff to review this regularly to ensure they remain informed. As we start to see more cases of COVID-19 in the community, it's inevitable that we may see more in our hospital. The important thing is if any staff are unwell at any stage, I'd encourage you not to come to work and to seek advice to get the right testing as required at the time.